Good morning, everyone. We're just on 10 o'clock, so I thought we'd make a start. So I'm Ruth Hussey, and I'm a non-executive director at the Integrated Care Board for NHS Cheshire and Merseyside, amongst other things. And I'm delighted that you're all here this morning. This is a senior stakeholder event, a critically important time in the life of tobacco control and its journey from many years ago when we started. And today's event is brought to you courtesy of the Cheshire and Merseyside Directors of Public Health, who are, as you know, based in local authorities, and the Cheshire and Merseyside Director of Population Health, based at the NHS Integrated Care Board. And they work together as the CHAMPS Public Health Collaborative, which celebrates 21 years this year, and Dawn's here, who was there at the outset as well. So we've got three aims for today: to discuss with you, to engage on what the priorities might be for the smoke-free Cheshire and Merseyside framework, and the importance of tackling inequalities across our region. This is one of the most important things that we can focus on. If there was one single issue to pick on, this would be one. This would be it. And to look at any other additional opportunities we have to realise our ambitions, so to hear from you and your ideas. And by the end of this session today, we'd like to agree and pledge together the Cheshire and Merseyside All Together Smoke-Free ambition, and to leave this room energised and ready to work collaboratively to really make this come to reality. So just a few comments about smoking, just to set the scene. It is the #1 single preventative cause of ill health and premature death, killing up to 2 in every 3 smokers, and not one of us here will be untouched by somebody we know who's been affected. It's also the single biggest driver of health inequalities, and updated estimates suggest that in Cheshire and Merseyside, the cost of smoking is somewhere in the order of 2 billion, with an average annual spend, including illicit tobacco, about £3,000 per smoker, which is more than the average household energy bill, even with the latest increases. So whilst Cheshire and Merseyside smoking rates have fallen to 11.7% in 2022, and they are slightly below the English average, there's no room for complacency. That's still an awful lot of people smoking. The government's committed to smoke-free 2030 targets of less than 5% of the population smoking. And as you know, there's really radical new legislation making its way through Parliament, which will help, and it's really timely that we have this conversation, to create a smoke-free generation. And that is an investment we need to make for our young people. So today's about reviewing our progress, renewing our commitments to ending the harm from tobacco in a way that's fair and equitable for everyone. So we've got lots of inputs today, some great speakers who will talk about what's happening locally and nationally. We've also got some time towards the end to hear your thoughts about the framework that we will discuss and where we need to look to work together and identify any other opportunities to make this a reality. Anyway, let's make a start. So I'm absolutely delighted to introduce our first speaker, Councillor Louise Gittins, who's leader of Cheshire West and Cheshire Council, Chester Council rather, and chair of the Cheshire Merseyside Health and Care Partnership. And I know that Louise is a passionate advocate for the reduction of health inequalities and works very closely with CHAMPS on the All Together Fairer programme. And she's going to share her vision for the future of Cheshire and Merseyside's action on